This episode of Straight Outta Health IT is brought to you by Welling, your trusted partner connecting healthcare organizations, data, and innovation for a healthier community. Welling helps healthcare providers navigate complex challenges, from analytics and AI to workforce solutions and community health impact. Because at Welling, we believe when healthcare is connected, everyone thrives. Learn more at wellinkcommunity.com.
Straight Outta Health IT, the mic stays surgical. Christopher Kunney moves vertical, purposeful. Strategist with the vision, breaking every system's cage. Guests unfiltered, flipping chapters every page. Industry talk raw, no sugar, no varnish. From policies to tech, the convo ain't tarnished. Blueprints unfold, the future in the dialogue. Cutting through the static sharp like a monologue. Change makers in the building, can't ignore.
All right, we're back. We're at the Texas Regional HIMSS Conference, and I have one of my best friends, and I'm a big fan of this woman, Erica Olenski. And Erica has a lot to talk about today. She started a new company. She's got a lot of amazing things going on in her world right now. We're going to get an update on some tragedy that's happened in her life as well, too. And she'll share that she's now turning into triumph and testimony. So welcome. Thank you for stopping by and having this conversation with me. I got to give you love.
Oh my, so good to speak to you. It's always a treat.
So Erica was on the podcast, one of my favorite guests on the podcast before. We were actually at the last year's Texas.
2 years ago.
It
was 2 years,
2 years ago,
yeah.
The Texas HIMSS Conference as well, too, and had an opportunity at that time to meet her amazing son. And I wanted her to give an update on what's going on with him and life after what has happened in her life as well, too. So, Erica, thank you again for stopping by.
Such a pleasure.
Yes.
Always good seeing you, whether it's in Nashville or Orlando or Vegas or pick your city that we've got some event going on at.
That's right.
But this one's so special, right? I mean, I live in Dallas, and so Texas HIMSS has always had a special place in my heart. I've been in and around the health IT community for most of my career. I served on the DFW HIMSS board for about 7 years.
Exactly.
From 2010 to 2017, 18 or somewhere in that time frame. Actually, just before I got pregnant with my son, August, who we were talking about before. But 2 years ago, we did have the opportunity and privilege of coming by the Texas HIMSS when it was in Dallas.
Yes.
And I brought August with me because he was so set on going to business meetings.
Yes.
He was... And I talk about him as an old soul, and he was, gosh, you could say 1,000 years old.
Absolutely.
So he would walk around, even as a kindergartner, with a little bow tie and his suit. He later bought himself a white two-piece suit.
Nice.
Oh my gosh, he was fantastic. I mean, he had the best fashion. But he got to come to the Texas HIMSS and got to go to his business meeting, attend a conference, see what it's like going to all the different booths and all the things that were going on. And he got to attend his very first podcast recording, which is you.
That's exactly.
So it's very memorable. For me, probably a little more so than him because he did nap through the entire.
Yeah, he had a long day by the time he got to me, so we let him see.
We did.
Well deserved.
And we had always committed to having a follow-up episode. I think we touched the surface on so many topics that we share mutual passions for.
That's right.
And so it was just such a special event, such a special moment. And he didn't get to listen to the podcast. And he just loved feeling like, what he was doing was making a difference.
Absolutely.
And impacting other people.
Yes.
Which is just another back testament to who he was as a person.
Absolutely.
And I'm using past tense because unfortunately August did pass away last summer in June of 2025. Thank you. And, it's tragic. He was a 4-time brain cancer and stroke survivor. And I tell his story, not as a tragedy in a lot of ways, but I mean, it was actually a triumph in so many more ways than it was ever sad. He was handed some really, really extraordinarily challenging circumstances. And August turned every single one of those, every expectation he exceeded.
Absolutely.
And then it really just defied anything ever, that was placed on him.
Sure.
And so it was just amazing to be able to share, part of my professional world with her a little bit.
Absolutely.
A couple years ago.
And birthed out of that came a foundation.
Yes, exactly.
Yeah.
So we founded August Artists in 2022. and have kind of scaled that, I would say a little bit more slowly than I would have liked in that time, in a large part because we were preoccupied with caring for August in those eras. But we have scaled to about 6 children's hospitals nationwide.
Congratulations.
We continue making brand donations whenever we possibly can. We have some very unique supply chain challenges in the world these days.
I know, right?
Whenever we can get the crayon packs and then boxes.
Washington, let's get our way. We need crayons for these kids.
We do. Or we need to manufacture them in place. That's another project for another era.
Right.
And maybe a future state of August artists at some point. But it's been really fantastic to see the organization grow. And I think just generally the response from the industry has also been very humbling because the message that I keep hearing as, whether I'm keynoting at an event or if I'm just sharing the story with somebody else or if it's on a podcast, the response is so received. And I think what's special about what we're doing is not just donating art supplies necessarily, right? It's actually meeting people and serving a need that we've systemically kind of ignored. And that's this impact of trauma in our nervous system for what we can do to really help people feel like they're cared for.
Right.
And I think healthcare's always tried to do this. So I don't want to say that we're not doing that.
Right.
But there's certain human experiences, especially in the era of AR, as we think about what it means to be human versus tech and where this disease can be made, is conversation around what it means to be human. And therefore, the care oriented around that human experience has really gained a lot of attention recently.
And I don't know, I would challenge a little bit, though. Healthcare is so focused on treating the patient, the body of the patient, right? And sometimes we do forget or not focus on the soul or the emotion, the trauma portion of the mental aspect of
it. So it's messy and it's different and nuanced for every single person, right?
And it takes time. And you don't have time as a healthcare professional.
Exactly.
You got to move on to the next patient.
Unfortunately, your nervous system is not something you can treat with a better, faster, cheaper solution.
Right, exactly.
We are bound as human beings to our fourth dimension.
Absolutely.
That's just a reality. That's why healing does take time.
That's right. And the mind controls a lot of that, too.
It does. Yeah. Absolutely. Absolutely. And so if we can care for people in that moment, in those experiences, we're just augmenting all the really amazing innovation that's already underway.
That's right.
So I don't want to suggest that what we're doing is in contest with it. It's actually just enhancing and a layer on top of all of that amazing work and innovation that's already there.
Yeah.
And so it's been fantastic. We've been able to grow. The reception's been fantastic from the marketplace. Everyone seems very receptive to this idea, and we're continuing to push it further. And so I recently founded a company called Monarch Futures.
Yeah, let's talk about Monarch Futures.
So founded Monarch Futures, and really the goal is to take some of the lessons learned from even working on the August Artist Project and say, what can we do about in a core company, specifically, health tech company, is there a way that we can help them bridge that gap so that what they're ultimately doing at the end of the day is delivering something that's meaningful for the patient and caregiver in the reality that they have?
Absolutely.
Again, you can't better, faster, cheaper solutions for people when they're healing and they're bound to time or they're bound to these emotional experiences. You can't override that, unfortunately. And I think that there's a big data element that we're missing, and that's the stories.
I'm going to ask you, so how that's a pretty complicated endeavor, right? It's like, world hunger. How do you fix that problem?
Yeah.
I mean, there's so many aspects to that, How are you going about it? Not to steal all your secret sauce, because you think hire her to really figure it all out.
Yeah.
But at a high level, talk to us about how are you approaching that?
Well, it's not super secret, right? I mean, it's human. Actually, we all possess the knowledge, right? It's just acknowledging it and organizing it in a way that we can take action from it. So what we do is we take stories that are unstructured data, and we try to gather those from key facts with those patient family advisory council work surveys, from social media, from all these places that people are talking about this story in healthcare, whatever that looks like, maybe Caring Grid.
Absolutely.
All these places hold rich data elements. And we just have to preserve the humanity in those. And so what we do is we take the collection of those stories and we try to take them into something that's actionable so that executives working in digital health, for example, are actually able to make more informed decisions in their product, in the services that they're developing. Are they ultimately serving the patient or caregiver at the end of the day in the reality that they actually have?
Sure.
Not a hypothetical use case that's designed to be very straightforward. Because
based on true, experiences that places have had.
Exactly. Because even the most simple example of a patient getting into the emergency department, let's say with a broken arm, might at face value be very straightforward. But there's still a lot of context to that person. Absolutely. Are their parents married? Are they divorced? Are they an athlete? Are they,
is this abuse? Is this spousal abuse?
Absolutely. There's so many nuances to it. And there's a lot of ways we address that today with social work and some other of these services that health systems provide. But what I really want to do is challenge the industry to think more meaningfully about those stories as true data. And say, what are we learning to take action on these so that what we ultimately develop and innovate actually serves the patient and caregiver at the end of the day.
And it helps to foster trust. I mean, I literally just finished the book that will be coming out this fall. It's called Diagnosing Distrust, why people call it Don't Trust the U.S. healthcare system. And a lot of it has to do everything you just talked about. Now, how do we start to gain or rebuild our trust and be culturally sensitive when these people are coming into an environment that they're looking to receive care, but in many cases, they're not. Those components of it are missing.
Yeah, so you're calling out the problem in one lens.
Right.
That problem is a true reality for our patients and caregivers across the board. And the caregiver is such an important stakeholder.
Absolutely.
We seek as a system, we don't view the caregiver often or rarely as a key stakeholder in the decision making. And they don't also recognize the services that they're even potentially rendering from a clinical standpoint as meaningful, or the administrative pieces that they're doing to close gaps in care. So there's a lot that we systemically are actually relying on unpaid caregivers to handle, to provide continuity of services, to make sure that the products and solutions actually serve the marketplace.
That's right.
But we haven't recognized them as a stakeholder.
That makes perfect sense.
And so we need to be doing that. And that's the heart of these stories. We're looking to the caregivers to also help provide that direction, collaborating with them directly, collaborating with these patient communities so that what we ultimately develop actually makes sense for the human experience.
I love it. What a great endeavor. I wish you so much success, and launching a company and expanding this methodology and concept across all the ecosystem as well. One of the things I didn't mention when I first introduced Ms. Olenski is she is one of our keynotes as well this week also. So tell us what you're going to be talking about today.
Yeah, so a little bit like the model I just described, actually called it the Monarch model. So the organization's called Monarch Futures. Monarch is a very important symbol. Butterflies, of course, are a symbol of change and transformation. And also, very uniquely, there's a space in the timeline and life cycle of a butterfly that goes into the chrysalis, where things liquefy, they become very disoriented. It's a lot of pressure, and you can't prematurely move from the chrysalis into becoming the butterfly. So that process is very sacred. And I think that it's a beautiful analogy for even a human experience in some ways. We can't necessarily rush healing per se. We are still bound to the terms of that experience. But if we support that moment appropriately, we can ultimately see what comes from it, and we can support that.
Makes perfect sense.
So Monarch's meaningful in that way. Also, monarch butterflies are very unique because they're one of the few species that work in the concept of legacy and actually orient to legacy. So the way they migrate is they might migrate actually over several generations while holding a vision for what it is that they're heading to, knowing they might not ever actually see the result of work and the effort. And so that also I felt was a very powerful metaphor for, legacy work.
Absolutely.
And then, the solutions that I'm proposing and advocating for, I fully recognize I might not see them in my lifetime. Right.
It lays the foundation.
It does. It does. So that other future generations and future leaders are able to build upon that.
That's great.
And hopefully make healthcare more human. Even if it takes several generations, we're moving now in that direction.
I love it. So 2 last things before we wrap up. One, tell me about this red cup.
Yes. Okay. So we learned a lot, as you can imagine, being a caregiver, going through a intense cancer journey.
Exactly.
In standard of care, outside the standard of care, using adjunctive therapies, using, clinical trial possibilities. And also in our experience, we were very reliant on private duty nurses, therapists, all those other people in our community that eventually became a family for us. So when August passed away, one of the things that was most striking was oh my gosh, he didn't just pass away.
It affected everyone.
The whole world that we had been oriented around dissolved overnight, right? Including the relationships that we had built very closely with some of these people. These are people that were working full-time jobs in our home, in some cases for 5-6 years straight.
Oh, wow.
These are like deep coworker relationships, right?
It's family.
It is, absolutely, it becomes family. And so when he passed away, one of the things that we chose as our family to do to continue keeping that connection is we decided to host a open house coffee hour with our private duty nurses and therapists and anybody that was a supporting function for August in the time that he was with us. They're all invited to come over from 8 to 9 in the morning. We open up our house, make a pot of coffee, and anybody who wants to come and visit can come visit. You don't have to talk about August. We can talk about him, but it just allows us every week to come together and stay in touch.
Stay connected.
So my cup here is very special, and it's a little hard to see on the video, but it has a really lovely picture of my son, August, on the side. And then it says August Coffee Crew, because we gifted these to the nurses and therapists that committed to also making a point in their schedule every week to come in and visit with us. And it's still going strong. We see everybody every week.
That's great.
They come over, we have coffee together.
I love it.
Yeah, it's really wonderful to be able to continue having those relationships because they're formative and they're not just transactional.
Absolutely. Well, I applaud you for your transparency, your resilience, and your commitment to improving the lives of others as well, too. And I know August is looking down from heaven and saying, Mommy, keep doing it, and again.
Thank you. Appreciate it.
Anything I can do to help support this. I want a cup, so let me know if I'm paid for it or whatever. Virtual coffee person.
We should.
We're going to have to expand this beyond just a local group. We can make this virtual now.
I love it. So funny enough, I am launching at the end of this month a caregiver coffee hour with one of my dear friends, Lindsay. She's also a bereaved mom of a child who is medically complex.
Absolutely.
And so we're going to be hosting monthly coffee hours on LinkedIn. The last Friday of each month, starting the last Friday of May. I think it's May 29th. And so we're going to start a coffee hour similar in spirit, right? And we're just going to...
I've referred some people to you. Too. So I would love to...
you can come hang out with us on LinkedIn Live and we'll talk about all things healthcare. It's very much an open book.
In fact, that sounds like a podcast.
Let's do it. It does sound like a podcast. It does.
Yeah, exactly. Yeah. Well, thank you again. Congratulations on being our keynote this week as well, too. Always good to see you.
Always good to see you.
And just keep me in the loop on everything that's going on. I'm there.
You'll be one of the first people I text. So no worries.
Thank you. All right.
Thank you.
We'll talk soon. Bye. All right, we're back, and I am with the architect of this event that we're having, this amazing event. And, pictures just don't do it justice. The number of vendors that are here, the number of participants, all due to this woman and her team's efforts, Elsie Gori. And Elsie serves as the program chair for the Texas HIMSS Regional Conference. And not only that, she is the 2025 Changemaker Award winner as well, too, for HIMSS. So welcome. Thanks for allowing me to be here.
Oh, thank you.
Yeah, so tell us a little bit about you and what you do. And
I'm a nurse by training, and I work currently for Lone Star Communications. We are the Rollin distributor for this area, this region, for most of Texas, Louisiana, and Arkansas.
Sure.
So I'm a nurse informaticist there. And what we do is we're more than just the button.
Exactly.
We do the data, we do analysis, and we relate it to quality metrics and things like that.
No, that's great.
Yeah.
So tell me, how has that become an important part of the delivery of care as a nurse now? I mean, having that background as a clinical professional, now moving into informatics, how are you applying that now? This space?
Well, unique to me is that I was also a customer before I became an employee.
Exactly.
Startup.
Sure.
The implementation and just getting things to the wireless devices in the hospital, nurses saving steps, reducing the noise in the hospital, and we work really hard to reduce alarm fatigue.
Sure.
Staff, make sure the
alerts are meaningful for the person who gets them. Everybody's not getting one, like the patient call for the whole unit or things like that. We're trying to make sure that it's meaningful.
Exactly.
Yeah.
And so obviously we're in the age of AI now, right?
Oh, yeah.
So tell us a little bit about, what you're doing in that space, how your company is looking at this platform now to improve the delivery of care and maybe some of the challenges that you're still facing with in this space.
So we have another company.
Right.
It's agnostic to nurse call,
Sure.
but it's called Olero.
Right.
And AI is in the center of that word Olero on purpose.
Right, exactly.
So, and we use AI and we have some amazing products. I'll tell you, as a clinician, I believe in.
Right.
And so not as an employee, but as a clinician, I believe in those. And they're actually cost effective too.
Sure.
So anything to help save, right?
Absolutely. Yeah. I mean, AI is obviously becoming an important part.
It is. We use it for our data.
Yeah.
I use it for the data that we provide.
Data is a currency now,
yes,
right?
It is.
Yeah.
Absolutely.
Absolutely. So talk to us a little bit about the theme of the conference this year.
So it's Cinco de Mayo, and it's it's an innovation fiesta, right? And tomorrow is the 5th of May, and in Texas, it's a big holiday that's celebrated as a victory.
Yes.
That was won. So we'll stay with that vein.
There you go.
All of our innovations and
I've got to be victorious.
Yes.
Yeah.
And we have so many amazing. Our sponsors are our exhibitors, and so they have some pretty amazing products.
Absolutely.
It's fun to just see how every year is like another layer.
Yes, it is.
And it's AI.
That's right. Everything's AI driven now. And again, you can't see it. I mean, we're literally in the exhibit hall, and all the vendors are actually like right behind us. I probably should have done the shot now.
Oh, that way.
But that being said, it's an amazing number of vendors who support the conference every year. Seems like it's growing every year. So.
I mean, we were one about 5 years ago, 6 years ago.
That's how you met, right?
Yes. And we've got almost 50 members here.
Wow.
Which is pretty good for
that
us.
That is great. Yeah, for not just us, but for any local regional conference that many participants.
Well, in Texas, and I was at a deal a little bit.
Well, you guys are big. Got to be big. Oh, it's in Texas. Yeah, absolutely. Absolutely.
Yeah.
So tell me a little bit about what Texas HIMSS is focused on now, as an organization. I mean, obviously that's 4 chapters, right? Or is it 5?
It's 4.
Okay.
The rural area has started, so we've combined.
Okay.
We're 4 chapters in a state. I don't think, we have a lot of land.
I don't think there's any other state.
There's some that has 2, but we have 4.
Absolutely.
Yeah. And so all 4 of us work together. And I think a lot of it is, I'll tell you that we're worried about, we support AI governance.
Right.
We just, people, we have to make sure that the people factor stays in there. And I think that's what we do when we advocate.
Sure.
As a state, we advocate together. We have our IT day, and we do that together. And it's AI governance and making sure that it's safe for our patients.
Right. I'm curious from your perspective, speaking of governance and speaking of, our legislators, what do you think they are in the understanding of the impact of AI on healthcare and the things that we need them to do in order to enact, laws and legislation to help better govern the adoption?
I feel like there's several camps, but the largest camps, there's a fear camp.
Right.
And then there's...
you see that in my own state.
Yeah. So, and then there's people who actually maybe used ChatGPT or Claude or Copilot. And so they're like, okay, even I know that this isn't right. So they're in the governance, but then there's other people that are fearful.
Absolutely.
Because they represent their constituents, right? And some of them in rural areas, it can really help, but they're worried.
That's right.
They're just worried.
And then I know you've been involved from an advocacy perspective as well, too. How is HIMSS helping those legislators gain a better appreciation and understanding of the nuances associated with AI? What AI is, more importantly, what AI isn't.
Right. Yes. So I think we did a really good job this year of making sure they had our contact, and we did receive communications back after our Health IT Day.
Oh, good.
They want, because that's what HIMSS is supposed to do. We're not lobbyists.
Right.
We're a source of information.
That's right.
And we have white papers at the global level that talk about just in general.
Absolutely.
What the paths are, and, like the baby steps.
That's right.
Got to take baby steps. We got to move fast, though.
That's right, because it's not slowing down.
No, and Texas meets every other year.
Right. Oh, I didn't know.
We meet every other year. And so...
And the pace of change is happening in the space.
In 2 years.
That's right. It's going to be a whole different ballgame.
Yeah, it looks different.
That's right.
Yeah.
That's right. So as we wrap this up, as a nurse, now a healthcare informaticist, a leader and change maker in this space as well, what advice would you give other nurses who are interested in technology, moving into the space of, data, aggregation and data, informaticists roles? What are piece of advice you give them?
If they're interested, I definitely, one is a lot, like for him specifically, our chapter membership is a bargain. Right. It's less than $40 a year.
Oh, wow.
Just start.
That's good.
Start there and get exposed to see what you might want.
Right.
And volunteer for technology rollout. They always want, a bedside person, volunteer if you're at a hospital, if you're in a hospital system, be a super user and volunteer, or come to, there's different ones. There's other organizations as well.
Sure.
And there's a lot of cross-pollination between AHIMA, ANIA,
exactly.
all of that. So
it takes a village.
join those, right?
Yeah.
And just see where your niche is.
Absolutely.
And then decide to get the education.
Right.
I believe you should get exposed before we pay for that.
Right. Exactly. Makes sense.
Yeah.
Great advice.
Yeah.
Great advice. Well, I'm going to let you get back to your day. Okay, she's the Wizard of Oz. She's painting other streams.
It's a lot.
Exactly. Well, I appreciate you saying that. It is a team effort.
Yes.
But I know people are pulling at your strings to make this day continue to go smooth. So thank you for stopping by.
Thank you.
Thank you for supporting me.
Yes.
And, keep up the great work, change breaker.
Yeah. Thorough change maker.
Thank you very much. All right.
I appreciate that.
Take care. Okay, we're back. And I have Nayan Patel with me. Nayan is the Senior Vice President and General Manager for Transformation. And is it Neteera?
Yes, Neteera.
Okay. Yeah, Neteera. Thank you for taking time out your schedule. It's a very busy and active conference, and Nayan's been an integral part of helping us put this conference together as well, too. So thank you for stopping by and chatting with my tribe on Straight Outta Health IT.
No, absolutely. A pleasure to be here.
Well, thank you. So let's start with your origin story, okay? Tell us a little about you and your background, and how did you end up doing what you're doing today?
So I was fortunate enough to move into healthcare about 20 years ago.
Okay.
There's a lot of luck and timing of people getting into health. I started in semiconductors, but made my way into healthcare. Sure. And then I was on the provider side. I was with Baylor Scott & White for 5 years.
Right.
Worked my way into running a couple of the heart hospitals. Sure. And then I was interim CIO for a number of organizations.
Right.
And so for 20 years, I've been in the hospital IT operating side. And then about 3 months ago, I moved into Neteera.
Yeah. Okay. Interesting.
Yeah, Neteera.
Well, how's life on the other side?
It's fun because we have a solution that is a specific use case.
Okay.
If it wasn't clear, I wouldn't say it was as enjoyable. I've dabbled in the other space with private equity firms.
Absolutely.
This one is more on the venture capitalist side.
Exactly.
But a solution is contactless vitals monitoring.
Okay.
And so, we are able to track heart rate, respiratory rate, sleep data, just by pointing a device that's like a deck of cards. It uses high frequency radar, fixed radar, just pointing it at your chest cavity. Right. About an 8-foot cone radius.
And captures all the relevant, vital information about the patient.
Yeah, and we can kill at 80% accuracy, or almost 80% of an adverse event about to happen.
Oh, that's huge.
And so in 5 days in advance.
Right. Oh, wow.
Because we're basically able to do trending against the baseline of how your body is operating for your breathing and respiratory rate.
Yeah. So as someone who has 2+ decades or more, in this space, on the operations side, now on the vendor side as well, too, you've seen a lot of transformation that's happened in healthcare. From your perspective, in this age of AI right now, what is something that is really standing out for you, good, bad, or ugly, that, is keeping you, up at night, or, getting your juices flowing? Talk to a little bit about, your perspective on AI.
Yeah, I think AI to me is a term that everybody uses a little too much to some degree. Sure. But it's like a tool like the internet was a few years ago.
That's right.
I mean, it's just another tool.
You said that. It's a tool.
It's a tool that we all use in our ability to execute technology faster.
That's correct.
To help business.
That's right.
Right? It's
not taking over the world.
No.
It's not going to rule us. It is a tool.
It's just a tool. You got to figure out which is the best way to use the
Application of it, yeah.
And that's the hard part.
That's right.
Okay, because you can use it for so many things, and it can, and a lot of it is automation.
Right.
Let's be honest. It simplifies things. It does things for you quicker.
Sure.
AI agents is where it gets a little even trickier.
Absolutely.
Because how many agents are being monitored? One gentleman said, or had a post said, there's going to be a new position called VP of non-HR.
Right.
Okay.
Oh, that's what you see.
Yeah. Because their job is going to essentially be to monitor all of these AI agents within an organization.
Exactly.
Because these are things running all the time.
Right.
And they need annual reviews, performance reviews too. Are these agents doing what they were intended to do?
Exactly.
And is their value what they need to be, right?
Are they causing more harm than good?
But we don't know. And they can get out of control.
That's right.
Not in the sense that they're going to take over everything, but they can do harm, as you say.
Hallucinations, anomalies. I mean, we're not managing the core data that's being generated as well, too. I mean, It's still very data-driven technology, right? And so we have to make sure that the quality of inputs it's receiving is not also creating issues down the road as well, to your point.
Yeah. And I think when you really go back to what the value is really going back to the use cases for the business outcomes.
That's right.
And so I think when you think about what we're trying to achieve is, you know, in our case with hospital and healthcare, how are we doing better patient care and improving outcomes? And regardless of the technology, there's a lot of people here today.
Yes, there are.
And I'm glad to see, you know, a good turnout.
Oh, sure. Yeah, amazing turnout.
So,
yeah, that's good. That's good. What's one thing you're looking to get out of this year's conference?
I mean, I think, you know, being in a new role now, I'm trying to understand how it's going to be like sort of the struggles and challenges from the other side.
Right.
But I still get called as somebody who's been connected to the provider side. But I think it's also...
And you bring a unique lens to the table now, too, Rip, to your company, right? Because you have been on that side and you understand the challenges, the issues, the nuances, the concerns that, you know, healthcare providers have. And you can articulate, I think, a lot more effectively to your leadership and to your organization that view as well, too. So that's a powerful superpower to have.
I think the one thing that I'll say is, over the last couple of years, that more and more companies are doing more, you know, more with less, right? And that goes to application rationalization.
That's right.
Because hospitals already have too much.
That's right.
They have too many interfaces, too many applications. Or how do you consolidate? So even like what we're coming with right now in our solution, I don't want to add on. I want to be behind the scenes, supporting the process and making that process improve.
That's right.
We don't need to complicate it. We need to improve that process that's existing.
Absolutely.
And that's what we're trying to do too.
Makes sense.
So I think as an industry, that's what I'd like to see more focus on.
Yeah, I use the term, we want to be gravity, right? We know it's here, we know it works, it has value, but I don't have to think about it, right?
Right.
And it helps me do my job on a day-to-day basis. So no, that's great.
That's interesting you say that, because I think one of our things is, we want to be able to come up with technology. In our case is something that's just not noticeable. You don't know it. With like, in our case, our device, it's capturing your data and you don't even know it's capturing it because there's no wearable. It's wireless. You don't even know it's there.
There you go. But it provides such a valuable piece of insight to the clinician and to the patient that literally can save their lives.
Yeah.
Well, too. No, that's great. Well, I'm going to let you get back to the conference. But if someone wanted to find out more about this device and, you know, wanted to meet you and learn more about what you're doing, what's the best way for them to get in contact?
Easy. You can visit our website, Neteera, Neteera.com. I'm easy to find. Nayan Patel. I think a lot of people here know me through the HIMSS conference.
Absolutely. He's a legend.
That's a good starting point and fighting from there.
Sounds great. Well, thank you, man, for stopping by.
Thank you.
Appreciate you and all the things you're doing.
No.
Good luck in your new role as well.
Thank you.
All right. All right, I'm back, and I have as my guest, Catherine Taylor Pearson. She is a president of the American Nursing Informatics Association. Catherine, thanks so much for taking time to stop by and chat with me. And Catherine has her support pet with her, or not pet, but the service dog.
Yes.
Bruh. As well, too. I was hoping I could get Buck on camera as well. Maybe we'll before the it's all over.
We can probably get you up in the chair.
I would love that. I would love that. And I'm sure his origin story too. So let's start there. Let's start with your origin story. Tell us a little bit about you and your background.
Oh, thank you.
Yeah.
Yes, I was born in California.
Okay.
I got an Army scholarship to college.
Exactly.
Went to Seattle college. Great time.
Right.
Spent 25 years in the military.
Oh, yeah. Thank you for your service.
Thank you. My pleasure.
Absolutely.
That's where all my IT training was. Army.
Army. Okay.
Army.
All right.
So wonderful experience.
Wonderful.
I was one of the first nurses who served as a regional CIO.
Oh, wow. Congratulations.
Thank you.
Yeah.
wonderful
Experience.
blessing. Yeah.
Absolutely.
Experience.
Yeah. And thank you for shattering some ceilings there as well, too.
Yes. It was very good to have my informatics customer relationship type of background.
Exactly.
With some big implementation.
Sure.
I also was my degrees in informatics. So I had that to kind of back me up.
Exactly.
I was also in the acquisition corps.
Oh, really?
As well.
So tell me about the acquisition corps.
Yes. So it's a specialty corps within the military. All services participate, even our civil servants. And we can get specialized certifications in information technology, program management, contract management, several other related specialties, finance.
Absolutely.
And it was just really helpful.
What a good opportunity.
Oh, yeah. To interpret that knowledge, to interpret the terminology of public contracts.
Right. Yeah, most importantly.
Most importantly, which, is really a very important talent.
That's right.
Have.
And so transferable skills to now the corporate world as well, too. Private sector.
And now I teach, so I'm able to use those as well with my students to help them gain that knowledge.
That's great. Hey, well, hi, man. We're having up to me now. That's good. I love it. So, wow. So, president of the American Nursing Informatics Association. Tell us a little bit about that association and what your focus is right now.
Thank you. Yes. We are a professional nurses organization of over 3,000 nurse informatics across the United States.
Exactly. It's amazing, not to interrupt you, but it's amazing to see just the growth of this nursing informatics, in our industry just over the past decade. I'm sorry.
No. It's a great subject. And I'm sure I would love to say they're all a part of our organization, but I'm sure we're not even represented.
Right, scratching the surface.
All of them, yes. Many are in the vendor space, some are in the hospital, education, like myself now. It's a great space.
That's wonderful.
Yes.
That's wonderful. So what are you seeing as some of the biggest shifts in nursing informatics profession, industry focus right now?
Definitely AI is on the subject.
Absolutely.
Everybody's front of their list and cyber and a combination of those two for sure.
And what's been the position of your association as it relates to AI?
Yes, I'm glad you asked that. So we are an organizational affiliate of the American Nurses Association, which is yet an even broader organization that we report to and work collaboratively with. We are very supportive of AI.
Oh, good.
We're very supportive of AI in my university as well. So we're coming up with different ways to teach competencies, have fun with it as a design tool, as a writing coaching tool, research.
Exactly.
And we ask our students and our members very simply when they do presentations. Recently add it as a reference, tell us how you're doing using it, add an attestation statement.
Exactly.
We're very, very pro AI.
You know what? I'm so glad to hear you say that because a lot of academic institutions aren't really all that bullish on the use of AI and the creation of content, how students use it for research, referencing it, in their, writings. But the reality of it is it's here. It is here to say.
It's in everything.
It is in everything we do. That's right. In fact, some of the content you're probably doing research on is created by AI as well, too. So the fact that you've embraced it and you're figuring out how to leverage it in the most appropriate ways, I do applaud you and the organization for taking that position on it as well. Absolutely. One of the other things I know I'm hearing with clinicians as they talk about AI is it going to take my job? Is it going to diminish what I do as a healthcare professional? Talk to us our listeners a little bit about your perspective on that?
Sure.
Yeah.
I understand the concern. It's change, right? All of us know what that feels like. I do think it's going to change how we do our workflow.
Right.
But I don't think our jobs are going that way.
Exactly.
We still need humans to interpret that data.
Absolutely.
Assist.
That's right.
Example, I use AI often to help me with making infographics for my students, charts. I'm also a black belt. So I, as you know, love teaching about Lean Six Sigma, failure mode effects analysis, all of those things. And it's great to run mock data models with generative AI to see if your theory is going to work.
That's right.
And it can save the testing time tremendously.
That's right.
I also did another exercise with my students on this association on doing a hackathon.
Oh, okay, cool.
And so people bring their ideas and then they can run the module through generative AI.
Absolutely. No code, low code. They can create mocks.
Mock graphics, everything.
That's right.
So I think it's a phenomenal tool.
Sure.
I think it will help us with predictive analytics.
Absolutely.
It can help us with screening tools. You know, when we go to the dentist now, a lot of our dentists now use it to help with their videography, to pinpoint where you probably going to have cavity and where you probably should focus more on brushing your teeth.
Sure.
So I think we can translate that into so many different things that we need to do in healthcare and help patients take more ownership of their care.
That's right.
And to move on.
I think you brought up some really important salient points as well, too. I mean, at the end of the day, AI is a tool, right?
Yes.
And it's applied appropriately can make huge impacts on the delivery of care, on how we, make decisions about helping us accelerate research, helping us pinpoint areas of, concern with our health. But to your point, we still need the human being in the middle of that to interpret that, help make recommendations, and help drive change in our environment as well, too. So what brings you to the regional conference this year?
I love coming. We see colleagues get to
Bless you.
It's a chance to really see what people are challenged with, especially since I'm primarily in academia.
Exactly.
So it's professional conferences are tremendously important to me, as well as my academic relationships with all my practice partners. So it really allows me to talk to people.
That's great.
And get to know them and understand what they're being challenged.
Sure.
Yeah.
No, that's great. So I'm curious in terms of the courses that you're teaching, are these early careerists? Are these folks fresh out of high school, going into college? There's a little bit of mixture of all of that.
I primarily teach in the graduate program right now.
So these are experienced professionals who are going that.
Yes, and many of them are still at the bedside. So it's a perfect timing. I'm able to coach and mentor. We're able to educate me on what the challenges they are and to show them different tools.
Absolutely.
Break it down, find solutions, literally drawing problems out.
Exactly.
Through different clinical workflow analysis type of procedures.
That's right.
But it's extremely rewarding. And,
wonderful.
Many of them are starting to get jobs now, noticing the market is really starting to pick up.
Oh, that's good. That's good to hear.
Love to report back and still very proud.
Absolutely. Absolutely. That definitely is going to be, there is a pent up demand. I think will continue to be a demand for resources like that to be in the center of care, in the center of business. And bringing that nursing background and nursing perspective to the table, along with now, how do I leverage technology and data to help us create better clinical outcomes, reduce some of the cognitive workload on professionals, and ultimately increase and improve the patient's experience can be very powerful. And there's nothing like having someone who's a clinician who also knows how to leverage data. That's a superpower, I tell you. Absolutely.
Absolutely.
Yes, that's great.
I am thrilled. We've also been able to partner with some different vendors who have been allowed us to use their tool in the classroom. And they have AI embedded in them. And so my students are able to learn those, see, right there. And so they can see that demand. I also teach informatics to providers.
Oh, really?
So these are providers primarily who come back to get their FNP, their psychiatric nurse practitioner. Some are learning to be chief nurses. And it's interesting to me to compare and contrast when I teach the
master's folks with my providers.
Right.
They have different questions.
I was going to ask you, what's the differences that you see in the two groups?
I see often with my students who are going, I would be more pure analyst, pure informatics roles. They're very tool-oriented and system-oriented.
Okay, right.
With my providers, it's always people first.
Right.
And we have to figure out how to get it into their workflow.
Okay, right.
And if I can't help them through that transition,
they shut down.
They shut down. Yes. So I don't want to go there. Yes. So we definitely work with trying to see how I can integrate it into the workflow, provide meaning to them.
Wonderful.
Example, we're ramping up our summer semester. Okay. So we choose an AI project, a notional one, we're going to work on as a team to implement. And then all the exercises are focused on that scenario.
Right.
So obviously ambient listening is very concerning.
Of course.
A great tool for many. It's scary to others.
Oh, absolutely.
Another one is the use of AI Sprite. We're interacting with that.
That's right.
Document both in inpatient and outpatient. And another popular subject right now, obviously, is a lot of the agentic AI.
Yes.
And how do you choose
agents? That's right.
How do you workflow that?
With agents that we can't talk to.
Yeah. And, you know, can they help me with this planning?
Right.
Can they help with the follow-up? Or, okay, let's see how this works.
Absolutely.
So it has been very rewarding to start opening your eyes on it. And I usually have a fairly good mix of folks who are very comfortable with others who are not, which actually makes the conversation very interesting.
Absolutely.
And we work together on that.
Good, good. So if there was a notice or a clinician out there interested in your program and wanting to learn more about it, how would they reach you?
They're welcome to email me directly.
Okay.
They're also,
what's your email address?
Yes, it's Catherine.Taylor-Pearson at ttuhsc.edu.
Okay.
I'm also on LinkedIn as well.
Wonderful. Well, I'm going to link in with you myself.
Thank you. Thank you, sir.
Absolutely.
We'll help them get them on their way.
Great. Well, thank you so much for stopping by. Thank you, Buck, as well, too, for stopping by and joining us. The next interview is going to be with you exclusively. So get ready. We're going to talk about that journey you're on as not only, you know, a healthcare professional and academic individual, but how you're using support animals to support.
Yes. If I was here by myself, I don't think I would be talking to half the people.
Really? Interesting.
Even though he is a service dog and he's working primarily for me right now, so many people love to come chat with me.
Absolutely, because of him.
Because of him.
He's I don't know, because I'm yes. Well, good.
It's very rewarding.
Great. Well, thank you so much for stopping by. I wish you continued success.
Thank you.
Thank you for all you're doing. Again, thank you for your service.
Thank you, my
pleasure. And thank you, Bob, for your service as well, too.
Thank you.
All right. Take care.
Thank you, Chris.
All right. All right, we're back again, and I have as my guest Ted Lindsley with Cognomic, right? He is the CEO, and he and I had a chance to connect last evening at dinner, and he has an amazing platform that he shared with me, and I wanted to make sure I got him on the program today to talk about how he and his company are transforming healthcare. But before we get started with that, I want him to give us his origin story, talk a little bit about where I come from, where you come from, and I'm hybrid because I don't come from healthcare. I've been there 4 years now, right? Absolutely. Yeah, everybody's born into the industry, indoctrinated into our own system. I didn't originally come from it either, too. Yeah, I worked 10 years, almost 12 years with companies like Hewlett-Packard, Universal Technology, others before I came into healthcare, too. So there you go. I think there's a lot of value in people coming from outside of the industry into the industry and bringing that vision and that perspectives as well. Because there's a lot of groupthink that happens in healthcare. There's so many people who've been here for so long, sometimes they can't see the forest for the trees. No, not really. Yeah, right. So it's nice to bring that different perspective to the table. It's timely, right? Yes, traditionally, that never happened because you entered this industry right out of school. Absolutely. And this is what you were knocking. Then it brought people from outside. Goes out here, right? So since COVID, that period, I think people are coming in now. Absolutely. And they'll refuse to accept the ground rules. Refuse to accept, well, this is just the way we do it. And that's how we've always done it. Right. It's a different mentality. Exactly. And I came here with that mentality originally as well, too. And So there's good and bad about that. The good is since I brought a different perspective, which helped me actually accelerate my career to the point I became a CIO probably pretty quick. Because a lot of the industry knowledge I brought from outside of healthcare, but it also helped me understand too why the industry is the way it is. Because there is some value in some of what we think is dysfunctionalness in healthcare, when it really is about patient safety. And the technology has to be better than the human being before the human being.
Well, that's an interesting observation, and you're right.
Yeah.
It doesn't matter if it's self-driving cars or AI or whatever. There's a lot of resistance about those things. So those you have to meet the human.
Absolutely.
Because I'm going to write the technology does it better.
That's right.
There's a trust factor you got to get for it.
Absolutely, right? Because it's going to be that doctor, that nurse that has to sit in front of that loved one that says why the technology didn't work and how it impacted that person's life.
Yeah.
So there's a high bar to get over, and there's a resistance to it because it has to have that level of efficacy. And I gained that appreciation in the process. Now, you still have to have a delicate balance between the two. You can't just default.
Go off the response. Exactly.
You know, we have to evaluate it, improve it, and ultimately leverage it when it makes sense to do it. So that being said, origin story. Let's talk about you.
Well, the platform, or you want to talk about me, my background? In my background, does
your background? Yeah, absolutely.
I'm a serial entrepreneur. You know, I founded 3 other companies before this, all in different industries outside of healthcare. I've seen success. I've had some exits. Right. Through a series of events, I found myself in healthcare about 4 or 5 years ago for the first time. There's a lot to be done here.
Yes, there is.
Healthcare is just now beginning to tackle some problems that the rest of the industry's tackled in the 90s and early 2000s. It's just behind, right? So it's time to catch up. Now, there's a lot of value to be found in technology, but how you deploy it makes a difference.
That's right. And
I won't get into a tirade about Epic and CERN and all these.
Sure.
Is what it is.
Because I would get in that with you.
A lot of people would. Yeah, but we're so what? You're not going to see that.
Right.
There's a proliferation of the last couple of years of AI tools. Every booth has an AI sticker on it. You know? Well, not everybody ran into that pretty quickly.
Right.
And then they started back and well, we're not getting the whole value proposition out of that. Let's change the name of it. Now it's called agentic.
Yes.
You know, just like life sciences with real world data. They go, oh, no, it's real world evidence.
Exactly.
Come on. There's the nomenclature. At the end of the day, change the narrative. It's the same old thing over here. We took a different path. So Cognomic, what attracted me to this is that this is a new company, but a platform that's been around for years.
Right.
So we're introducing a platform that's been in production 4 years in a major healthcare facility.
Right.
It's proven, it's validated, and the results can be repeated at any facility.
Okay.
So simply put, what is this?
Yeah, I was going to say, let's get into the meat and potatoes of that.
Yeah. So this is a data operating system for the AI era of healthcare.
Now, that's an interesting definition.
It's what it is.
Yeah.
And people say, well, what does that mean?
There you go. I was going to ask the question. Yeah.
It is a single end-to-end platform that replaces more than 25 SaaS tools.
Right.
You no longer need Snowflake, Databricks, Power BI, Tableau, Esri, Rhapsody, Datavant, Trinetics. Keep going all the way through.
Exactly.
One single platform does the work of all of those. So simply put, the system will ingest hundreds of data feeds simultaneously. That's your live EHR data, is that ambient listening, unstructured notes, clinical trials, government reports, genomics data, hundreds of feeds pouring in. First stage, stripped, cleaned, validated, semantically reorganized, and then spit out in its own BI tool. It does this without leaning on any other vendor. Right? It's not spitting out spreadsheets or PDFs. It's giving you maps, charts, graphs, visuals you can use.
Yeah, actionable information.
So where the data operating system moves you from the traditional data storage, which everybody's doing today, there is no more data warehouse, data lake. That doesn't exist. Instead, it's a river of free-flowing data.
Oh, interesting. I like that.
That's what we call it, a data river. Right. So it is no longer a silo or a lake of stagnant data. It's constantly updating, constantly refreshing, constantly cleaning and validating.
Exactly.
So like turning on a tap, get a fresh flow, light and instantaneous live, the most current information.
Absolutely.
Now, what do you want to do with that? Since you have resolved the data, now it doesn't take quarters or years to build tools. It unshackles you from all the SaaS vendors. You can build your own things literally in days. What do you say? SQL, Python, no code, low code. So the clinician can now build what they want themselves. Do it very rapidly and work and think the way they're accustomed to versus the way that some software engineer interpreted how you might want to work, forces you to be like this.
Right.
So it unlocks your imagination, and we've seen this where it's been implemented already.
So give me a kind of a case study of something this technology has been able to provide some insights on that drove some real ROI.
Sure. It stems out of Rochester, New York.
Okay.
This platform has been, and the longest, it's been there in operation now for 4 years. It got them their NCI designation last year. No small task. Now, he's been trying for years.
Right.
This is the platform that turned the corner for them. Speed, efficiency, eliminating duplication of effort, just in that one oncology department, they're saving $6.5 million a year on SaaS tools.
Repeat that again.
$6.5 million a year. Yeah. No more of SaaS tools.
That's right.
There were 15 or 20 offshore contractors, which they were paying for, to manually crunch data going into, I think it was Databricks or sort of like, don't need them anymore.
Right.
That's more savings.
They were to cut costs there.
Yeah. Clinical trials. I thought this was no big deal. They said, well, we save an average $10,000 to $50,000 every time we launch a clinical trial. Because. Mm-hmm. I said, well, is that important? And they said, yeah, there was over 100 clinical trials. That's over $2 million. That adds up. I mean, there's so many possibilities. Reduce pajama time. Sure. The system automatically schedules for the physician. They don't sit at home for 30 to 60 minutes figuring out, who am I going to see tomorrow? What do I know? All right. Right there when you walk in, it's got you. That's great. So simplifying. I mean, we're just scratching the surface here. There's so much more, right? That's good. It's been so successful in that department and all the other departments that want it.
Right.
Easily translates to those as well. Sure. So as we talk to more customers,
this is not just purely clinical. It can be leveraged off. No,
this is pharma, CROs, academia, research providers, payers. Okay. This literally is the foundational platform on which we build all AI and agentics for healthcare. Right. It's built by healthcare for healthcare.
Wonderful.
It's been trained over the last 5 years on 162 billion records in a live environment.
Wow.
Not old data from 20 years ago.
Okay, repeat that number again.
162 billion individual records in a live environment, tweaking, progressing to make sure everything is.
I was going to ask you about clinical quality, but I tell you, and efficacy, it's been trained on that amount of information. I can imagine the quality of the insights that are coming out of
unmatched.
This tool.
Unmatched.
Absolutely.
Yep. And I know it sounds fantastical when we tell people what we do. They say, it sounds good if you can really do it.
Right.
And I'm thinking,
that's what they do, right?
Yeah. And they don't believe it.
Right.
And I get it because they've been lied to for 20 years. So why should they believe me?
Yeah, right.
And I get that. But when you see a demo, then we got it. Because unlike a dazzling SaaS demo,
right,
we're talking about guts level data, processing. Sure. This is the validation of the data. You can't fake that. That either works or it doesn't.
That's right.
And so when they see it and the output, they're shocked.
Okay.
Makes sense. And that's the power of the demo.
Yeah. So what brought you to this conference?
I've been going to HIMSS for years. We just came back from the national conference.
Okay.
We had 35 meetings set up at the national conference. 21 of those are already pursuing with us an implementation. So it's going to take the better part of a year to navigate the processes. But that is enormous, right?
Absolutely.
And so as we go to more shows in different spaces for healthcare and just get the word out, then it's going to take a couple of years, but this is the future.
Well, that's a good problem to have. A pipeline like that.
Yeah, exactly, right? Can't go fast enough for me. And the faster that you can actually clean these things and show value, or the better. That's great. It does something else too. It unlocks the imagination of the clinician.
Okay.
And this is a byproduct. So clinicians normally are having to think like this.
Right.
Within certain guardrails, this is the program. I only can do this.
Right.
Now they can sit back and say, can I have a button that does this for me, or a dashboard? Or can I get a widget or a tool? Or why? Because then I can do all these magical things.
Right.
So they're free to imagine the workflow and how they want to do things more efficiently. I mean, ultimately, they want to do the right course. They can do it better.
That's right.
But they've never been able to before.
Absolutely.
They're limited by what the software can do. Now the software will do what you want it to do the way you want it to.
Right.
And that's transformative.
That's powerful. So I know you want to get, you got a lot of hands to shake and a lot of folks to talk to. You want to get back to the conference as well, too. If someone wanted to reach out to you to learn more about this platform and technology, or just to meet you, because I think you're a really sure guy, too.
Oh, thank you.
How do they get in touch with you?
Sure, let me go to the website, obviously, and submit it. You can ring me directly. But
what's the website?
It's cognomic.com. COGNOMIQ, not Cognom IQ. It's Cognomic.
Right.
As in cognitive understanding with IQ and elements, right? So it's ted.lindsley@cognomic.com.
Wonderful.
One thing you launched at HIMSS, the national conference 6 years ago, was any customers signing a contract by the end of this summer, we will guarantee 100% ROI and 7-figure additional savings per year.
Wow.
Or it's free. Absolutely. We'll refund every dollar. Right. You know what we can do.
Or you put your money where your mouth is.
Absolutely. Right. Or for a nominal $10,000, we'll set you up at a boot camp arrangement or maybe there for 90 days with your own data.
Right.
You won't go back once you do that.
There you go.
And that'll let you show your leadership. Oh my gosh, look at this.
Absolutely. You heard it, folks.
Yeah, I was in writing.
This man's got the magic deal. So, hopefully you'll take advantage of what he said. Thank you so much for stopping by, man. It's really look forward to staying in touch. Good luck in all the future endeavors and enjoy the rest of the conference.
Thank you. All right. Hey, take care.
Straight Outta Health IT, where the talk stay free. Tune in, turn up. This is where you want to be. Data-driven dreams, they decode the code. Hack the status quo, make the old ways implode. Gusts dropping gems like pockets of gold mines. Healthcare's front lines, redesigned in real time. Kunney got the mic, architect of the chatter. Revolutions in the air, healthcare's new chapter. From telehealth to equity, nothing stays unseen. This is more than a podcast, it's the dream machine. The system's pulse is beating to the sound. Voices of change.